Hi, everyone. Thank you very much for joining. We are very excited to have Dr. Perry Hystad today with us. Perry is an associate professor in the College of Public Health and Human Sciences at Oregon State University, the program director of the Environmental and Occupational Health Program, and he also leads the Spatial Health Lab. His research focuses on environmental exposure assessment and epidemiology with applications to air pollution, healthy cities, and climate resilience. Today, Dr. Hystad will discuss novel approaches in spatial environmental epidemiology. So, Perry, the floor is yours. Thank you.
All right. Well, thanks for the invitation. This is always a fun presentation because it tries to put together all of the different research that we're doing over here. Let's see if I can. And this isn't just me. So I lead the Spatial Health Lab. So what I'm presenting today is research from a whole bunch of people besides myself, where we look at air pollution, healthy built environments, climate resilience. And then a big part of what we do is environmental exposure assessment. So how do we create better exposure predictions for large health studies or risk assessments? And so I'm going to be showing some examples of different applications of what we've tried to do in that space. So first of all, why do we need better data, models, and methods? This is fairly straightforward. We don't do a good job quantifying environmental exposures to look at how the environment contributes to chronic disease development. And so we know that that's a large portion, so 70 to 90%. And this is environmental risk defined broadly. So this isn't environmental hazards, but this is everything non-genetic. So I think we're all familiar with the term, the exposome, so the totality of environmental exposures throughout the life course. This can be thought of as external, the external exposome, so what happens outside of an individual versus the internal exposome, which is the top-down omics-based approach. I am very much on the external exposome, so all of my research is using GIS spatial models or measurements to characterize different environmental exposures. So we need both, and this is actually something that I'm trying to develop as part of my research now. I definitely don't have the expertise to look at the internal exposome, but we need research projects that really integrate these different methods. So if you're looking at biological mechanisms, you really need to focus on the internal exposome. If you're looking at sources, regulations, factors that are driving exposure, you need to look at the external exposome. But really, we need to start putting these together in the same grant, because it tends to be one grant or research program will look at external versus external. So after this presentation, if you have any ideas, I would love to hear those. So if we're thinking about how we do a lot of environmental epidemiology for air pollution, for built environments, we're using geospatial models to estimate an exposure at a residential address. And so 99% of studies are based off of the residential address. And there's a lot of uncertainty in terms of how that residential exposure actually corresponds to personal exposure. So if we think about measurement error, as well as confounding that might go on between the socioeconomic and structural factors that determine where somebody lives, and that may also relate to an outcome. So what I'm going to be talking about here is, can we use geospatial models to better estimate actual personal exposure? So can we start either moving away from residential-based exposures or using better models and methods to try to capture that personal exposure? So right now, there's sort of two groups of exposure assessment. There's this residential-based modeling approach and a personal exposure approach. And what these look like is, in a GIS, you'd come up with a land use regression model, for example, which is shown here for NO2 air pollution, and then you'd attach that to a residential address versus maybe giving out personal air pollution monitoring as well as GPS to measure how a person actually interacts and is breathing in air pollution. And so what I'm arguing is that these two approaches are becoming blurred with new data and new approaches, and I'll show you some examples in this presentation. And so back in 2017 already, me and Andrew Larkin published this commentary on how we could use new technology to move towards long-term personal exposure assessment for air pollution. And this could be done by integrating information and data that we could get from smartphones, big new data sets, and then personal monitoring. Most of what I'm going to talk about today is the blue and the red bubbles. I don't have too much time to go into how we're integrating personal monitoring into these studies, but if there's any questions afterwards, I can talk about that as well. Sorry, I see a chat here. I don't know if this is for me. No, okay.
No, I'll monitor the chat.
Okay, so people can hear me. So the first thing is, can we integrate personal time activity information? And so like I was saying, most studies are based off of home address. This is a study in the Washington State Twin Registry where they got 400 twins to wear GPS and accelerometers for 2 weeks. So this was done, or it was started back in 2015. And this was a full R01 to try to measure this for 400 people, collect additional survey data to look at how the built environment was influencing physical activity. And so we took this data and looked at the relationship between if you assigned an exposure at the home address compared to what you get from GPS measures. And you see you get sort of moderate to low correlations depending on what the spatial and temporal resolution is of the exposure. So NO2 is around 0.65, PM was 0.8 because it's more of a regional pollutant, NDVI was 0.52. And so these are passive exposures, right? So you don't have to do anything for air pollution to have an impact on your health. When we look at active exposure, so for example, how the built environment might influence physical activity or how green space might influence mental health through stress reduction, these are what I call active exposures. So when you're sleeping in your house, these are not going to have an impact. And so using this data, again, we see these really strong relationships between built environment characteristics, and these are defined at a GPS point, and the odds of physical activity. And this is not surprising, right? This is basically looking at where do people choose to be physically active. And so they're being physically active in parks, in greener areas. They're not being physically active around high levels of traffic air pollution, traffic noise. But when we ran this analysis based off of residential built environment exposures, you see nothing. So the built environment characterized in the neighborhood around a home is not capturing where people choose to be physically active. And so this then raises the question, do we need to, or how do we measure long-term time activity patterns for the thousands to potentially millions of individuals, right? If we're thinking about the power and the sample size we need in a lot of these environmental epi studies, hundreds of people is not going to do it, right? We need to do this for thousands to potentially millions of individuals. And this is where one of my grad students, this was 4 or 5 years ago, was like, well, this data already exists, right? Everyone who shares their location on a smartphone has that data collected. And so we started digging into what's called Google location history. This is usually when I ask people if they've heard of this and if they share their location on their smartphone. So basically, if you have an Android phone or if you have an Apple phone with Gmail or Google Maps installed and you share your location, your time activity patterns are being collected. So for me, I have information from 2013 onwards. This is just an example of one day of me biking into work, spending the day at work, going to the pub after work, and then coming home. So this is one day. I have 7 years of this information. This is another example when I flew to a conference in Toronto. right? If you have your phone with you and you have Wi-Fi or cellular access, this data is being collected everywhere in the world. So this is usually where I pause to say this is very invasive data, right? This is different than GPS. So some people either don't know that this data is being collected. And so the best estimate we have for people who share their location on their smartphone is a third of people share it, a third of people don't, and a third of people just have no idea what you're talking about. So there are some people who have this data who might not have known that their activities are being collected. And this is time activity patterns collected over years and potentially decades moving forward in the future. So we got a R21 to look at, could we use this Google location history data for environmental health research? And so for looking at how the built environment might influence physical activity. And so it takes, if you're comfortable with computers, it takes 2 minutes to download this data. And so this is an example of the raw GeoJSON file that's downloaded. You go to your Google Takeout, you click on location history, and you download a zip file with a raw GeoJSON file, as well as one that tries to classify locations and trip mode. So was that location in a vehicle? Was it in a bike? Were you at a store? So you end up getting 3 files, a raw data file, a file that classifies places or locations, and a file that classifies activity. And this data is very, very clean. It's actually pretty easy to work with, but it's huge. So what we did is we contacted the 378 twins who participated in that previous GPS study. 16% of people provided data. So this is, they provided retrospective or historical Google location history data. 14% of people did not have historical data. So this means they did not share their location, but they turned it on for prospective data collection, right? And so from those 16% of people, so this was 61 individuals, there was 34 million data points, 67,000 days of activity data. On average, it was 752 days per person and 375 locations a day. And what you see in the back is just a summary of when we have data that was provided from these 61 individuals. So this was going back to 2012. Some people actually went back to 2010, but that was prior to what the current data looks like. So this is a long time series of data. This is just looking at when that data is available temporally. There's also a spatial accuracy flag. And so most of the locations were flagged as accuracy, spatial accuracy under 25 meters. So this is not GPS data. This isn't a continuous stream of locations being collected. So every 15 seconds, it's basically when you change location. So it's a little bit different. And we looked at just comparing the locations from the GPS data that was collected in that other study to what we got. And we found that if you look at just all locations, 95% of GPS locations were captured by GTL data if we just look at the spatial correspondence. If we take out residential address, and so look at all of the other locations, we see that it's around 84%. So this is not GPS accuracy, but this is still very, very detailed in terms of the spatial accuracy of this location. And so what we did is just a test. We said, okay, we have this information for 61 individuals. Let's do an exposure assessment for NO2. And right off the bat, you see that for 61 individuals, we have a huge geographical range of locations. So just about in every continent for 61 people. And I don't know, this is the geographer in me, but I think this is like the coolest map ever. And I'll talk about how we put together this global land use regression model later. But it really forces you to change your thinking about exposure assessment, right? This is now dynamic exposure where we need to assign in this example, NO2 based on hourly concentrations. If we really want to leverage the power of this data, we can't just apply an annual average, right? So if you want to look at like what's the air pollution when people are commuting in rush hour, right, versus later in the evening. If they're on a bike versus in a car, and what their inhalation rate might be and how that might change internal dose. Or starting to integrate infiltration factors, because we know if someone's in a home, right, if they're at work in an office building. And so this is really moving towards this personalized exposure measure and what is driving exposure. And so part of this study, we're providing summaries back to individuals, and that was part of an incentive to participate. So what is your air pollution exposure? How does that correspond to other people in your community? How much time do you spend outside in nature? Those type of things. So trying to provide information back to people. But when you start moving to this sort of personalized exposure assessment, you really have to start thinking about personal behaviors and how those now might be the primary confounding factor. And if personal exposures, at least for etiological research, is better than residential-based exposures, which might be this sort of latent exposure variable in some situations. And so Mark Weiskopf has this nice paper in terms of sort of the trade-offs between personal and proxy measures. And that becomes really clear when you start digging into this like long-term time series of time activity patterns. So the Google location history data is a feasible and very cost-effective approach to capture time activity patterns. Existing cohorts could try to integrate this retrospectively. So for example, the All of Us study is targeting 1 million people. If you got just 10% of that cohort to provide this data, that would be 100,000 individuals where you could link this information to all of the other survey, health administration, biomarker data that's being collected. And they've done something similar to this with Fitbits. So people have provided their own data to the All of Us study from their Fitbits. And this is along the same line of bring your own location data in a sort of citizen science framework to link to your other health information. Privacy is still a big concern here. And so we were thinking of developing pipelines where you would never actually look at the data. So people would download it, it would go to a secure server, and you would just run algorithms to drive exposures. We've done some sort of qualitative interviews with participants, thinking that that might make people more comfortable in providing the data, but they really don't see a difference. And so if they provide the data, they provide the data. Having an algorithm run on it didn't really make a difference in terms of more people wanting to provide that information. So I could stop here and take quick questions, and I'm going to move on to some other examples of measures and models. If there's any burning questions, or we can wait till the end.
Can I ask a question?
Yeah, for sure. And I can't see hands, so feel free to jump
yeah,
in.
I mean, one question is that in many studies, I work on a lot of existing cohort studies that might go back 10 or 15 years. And I think this is a common theme in at least the air pollution studies and built environment studies. There are challenges to go back 10 or 20 or 25 years, but there may be many more challenges if you want to use GLH data or geospatial data of this type. I'm wondering whether you have tried to address this question in your research. I mean, how?
Yes.
Or if there is any way to access someone's geolocation going back on time, if you can ask for that.
Yeah. So NCI has a new cohort they're starting up, and they're really interested in trying to integrate this. And they had the same question: is like, we're looking at latency periods of 30 years. How could we use this? And this will only go back to, we had data going back to 2010, but realistically, it's going to be 2015 where people have decent amount of data. And Google actually just changed their data privacy rules, where new users are going to have their data deleted after 2 years, unless they opt into keeping it. So existing users will keep their setting, but new users are going to have this new setting unless they change it. So even there, what we were thinking with NCI is that you would use this in some type of like regression calibration approach. So even though you're only going to have more recent data, you could use that in the subset to try to calibrate your longer term exposure models. And so it's not ideal, but I think it would still provide new information on measurement error that you could integrate into sort of the whole cohort and the retrospective component. But you're not going to be able to get this data yet going back before 2010 for sure.
Can you say a bit more about the privacy issue? Because you know, nobody wants people to know everywhere they go, but Google has it anyway. So how private is the data in Google compared to the, you know, you taking it? Do they give it to other people anyway? Or
yeah, so this is a really important question, and there was a lot of feedback in terms of like, if you frame this as Google data, people are like, there's no way, I don't want to participate at all. But this data is an individual's data, right? So it's collected by Google. They use the data in anonymous fashions to increase their algorithms and that kind of thing. But this really has to be framed as like a citizen science approach. So this is your data, right? You own this data. You can delete this data. You can stop collecting this data. But we can integrate this data to come up with new information on your exposures, on your potential disease risks, if you provide it, and we link it securely to existing health data that you would already have provided to a cohort. So that framing, I think, is really, really key in terms of this is an individual's data, right? They own this data. They choose what to do with it. This is not Google's data. Google collects it, but this is an individual's data. And one thing that was—
do we know? Go ahead. Yeah.
We originally did a survey even before this R21 to see like, is this even feasible? Will people even provide it? Because this to me was a true R21 where I did not know if this would work. And so we surveyed 1,000 twins, and the 700 or 650 that replied, like 90% of them said like, yeah, for sure, I'd provide this data. But they didn't really know what they were providing. And so when we consent people, we actually have like an example data set of this is an example of a map of GTL data. This is an example of a day. So people really understand this is very invasive data. And so that, I think, had a big impact on dropping our response rates, because you really have to make it clear, like, this is the type of data you're providing.
Do we know that different places like Cambridge Analytics or whatever aren't accessing the data anyway without us knowing? I mean, how secure is Google?
Yeah, so Google does not sell this data. They don't sell individual data, but I don't know exactly how Google uses it. They obviously use it. They're collecting it. They're spending a lot of effort to collect this information. So they're using it for something, but at least with their terms of service, they do not sell and provide individual personalized data. So they might aggregate it somehow, but they don't provide individual data. Yeah. Okay, I'm going to keep moving on here because I always go too late. So now I'm switching gears to say, okay, how do we look at better models of exposure? And so we have all of this new data. We have these new methods. How can we integrate those? And so this is just an example of all of the government-run regulatory monitors of the world. This is sort of the gold standard of environmental data, if we think about sort of measures. But we have a lot of new things that we can start using, right? So GIS data, there's a lot of exciting developments in with satellite data, connected vehicles and LiDAR, imagery, connected devices, social media, and then sort of citizen science approaches. And so there's a lot of exciting things going on here. I'm just going to highlight 3 of them. One is new computational resources available and what we can do with those. Image-based exposure assessment. And so this is developing really, really rapidly in terms of applying deep learning models to imagery to assess exposures. And then spatial data integration. How do we take all of this and put it together into studies? So we recently created a global spatial-temporal land use regression model. This is using all of the existing monitors that we could at least download for the world. And we created a daily land use regression model at a 50-meter resolution. And so this is from 2005 to 2019. This is a crazy amount of data. So this was built off of 5.7 million daily air pollution measurements from over 8,000 monitoring locations. And so we have daily predictors in terms of satellite NO2 from OMI, daily meteorological information, and then all of the other traditional parameters, a temporal resolution where they change at. So seasonal NDVI, annual population density. So trying to integrate the temporal component into this. These data now, we have a preprint up, and all of this data is available for download if people want to use it in their studies. But the only way we were able to do this was by leveraging the Google Earth engine. And so the Google Earth engine allows you to access publicly available satellite imagery, but also use Google servers to crunch that data. And so we can now sort of start doing planetary scale analyses. This is an example, just zooming in on one city. Let's see if this video works. But basically, taking the time series of satellite information and using that for exposure assessment in an efficient way, right? And so this is just showing the expansion of Las Vegas, the shrinking of the aquifer over 20 years. Using traditional desktop approaches, that would be nearly impossible to do. We would never have been able to do this model. And so this is just a plug for our Sharps workshop that's coming up. It's been really surprising to see how slow these new methods have sort of infiltrated into environmental epidemiology and exposure assessment. So 4 years ago, I had a friend who was doing a green space analysis across Canada using NDVI. It took him a year to develop his NDVI exposure assessment. So downloading all of that satellite information, removing clouds and water, tiling it together. In the Google Earth engine, you can do that in a day. So it just completely changes how you do satellite-based processing over large geographical areas and long time periods. Moving into image-based exposure assessment. This can be images from a satellite, or this can be images from the street, right? It can be any image. But how do you use modeling approaches, and most of these are deep learning modeling approaches, to automatically extract information from those images? And this is a nice commentary paper that really goes into sort of the opportunities and challenges with using images for environmental exposure assessment. So we got another R21 to look at if we could use street view imagery to assess the relationship between urban green space and mental health. And this was within this Washington State twin registry. So this is just an example, right, of a street view image. How do we pull green space exposure metrics from that? There are a lot of different pathways by which green space might influence mental health. So reducing air pollution, noise, heat, increasing physical activity, increasing social connections, or also just the direct impact of reducing stress and attention restoration from visually looking at and viewing and interacting with green space. So that's an example of one of these active exposures, right? So you're not going to have this sort of stress reduction pathway when you're sleeping, for example. And so most studies looking at urban green space use satellite data, what's called the normalized difference vegetation index, which just captures if there's more green vegetation, there's a higher score, the highest is 1. If there's no vegetation, it's 0, and water and barren earth can go slightly below 1. But this is sort of a bird's eye view of urban green space, which is very different than how people actually experience green space, mostly on the street when they're interacting and moving around the built environment. And so we used what's called the PSPNet algorithm. This is an existing deep learning model that does image segmentation. So it basically takes an image, and for every pixel, it classifies it as, okay, that's a car, that's a light, that's a sidewalk, that's a tree, that's a flower. So you can start summarizing what is in an image. So we could take that, say, okay, it's 30% of it is trees, for example. This is a starting point. So we did this, but this definitely doesn't capture sort of all the nuances of nature quality or attractiveness or safety. And so what we wanted to do is say, can we predict more complicated perceptions of the urban environment? And so what we did is we created a survey on Amazon Mechanical Turk. So this is where we paid people 10 cents to rate different images, where you'd see these two images and it says which street has a higher quality of nature. And you move the slider for what image you think has a higher quality of nature. What image is safer? What image is more attractive? And so we got thousands of people to do this, to basically label images to create a new deep learning model that would try to predict these perceptions. And so what we found is that we actually can predict these perceptions. So for green space quality, we could predict around 77% of the pairwise image comparisons. So which image would win in terms of what street has a higher quality of green space. Safety did less well, and then relaxing and beauty. And this image here just shows for those perceptions, what are the features that are contributing the most to those. And we see that they're sort of what we would expect for safety, nature, relaxing. It's the type of nature and green space that's on that street. So what we did then is we took all the addresses in the twin study. So this is 20,000 twins. We take their home address and we download the closest Google Street View image. And then we sample 5 more images from their neighborhood. So trying to look at what like visual green space might be outside the home compared to what's in the neighborhood. We applied PSPNet, and then we applied our new deep learning models for perceptions. The first thing we wanted to see is this a new exposure measure, or is this just another thing that's highly correlated with NDVI? And so what we found is that if you look at NDVI here and the sort of image composition, so the percent of the image that's trees, green space, blue space, built up area, we see a pretty low to moderate correlation. Same as if we use our perception measures. So the correlation between NDVI and green space quality was only about 0.54. And so this says that these are in fact different exposure measures. We then looked at the twin correlations and this standardized variance component for our mental health outcomes. So this is trying to decompose the variation between the genetic component, the shared environment. So this is the early life shared environment component versus the non-shared environment component. And so for our mental health and general health outcomes, we see that there's around 30% is genetic, a much smaller shared environment component, a shared early life component. But then what we tried to do is do this for our green space exposure measures. And so this is typically only done for health outcomes. And there has been some interesting work in this cohort that found a pretty strong genetic and shared environment component for people or twins choosing an urban or a rural environment. And so we see something similar here where for NDVI, there's this pretty strong shared environment component. And this has always been my issue with NDVI, is that this is really a measure of urbanization. And so you have different measures as you move out into the suburbs and rural areas. And so we see that here, and to a lesser degree with our street-based measures. And so this is the results of applying these new measures to look at depression, anxiety, stress, and poor or fair health. What is interesting here is that we see this association between our green space measures, for example, and major depression, but NDVI remains the strongest predictor. And this is completely opposite to what I was hypothesizing. But here, for example, you see a 15% decrease in the odds of having major depression. Similar results for anxiety, less strong, as well as for poor and fair health. And so these are still sort of preliminary results where we're looking at green space quality as an independent variable. So we're not looking at sort of the interactions between NDVI and green space quality, which is the next steps to this, right? So you have to have green space there, and it has to be good quality for you to have some type of potential benefit. So these are fairly hot off the press results. Okay, so now I'm going to switch and go into data integration. And this is a HEI-funded study that we have called the Transit Accountability Study, where we're looking at vehicle emission regulations and local congestion policies and how these have or have not benefited birth outcomes. So this is 7.2 million births over a 20-year period. We have really detailed information from the Vital Statistics Registry. We have standardized methods to assess traffic exposure. And basically, we spent a year just integrating as many different data sets as we could into this. And so we took CoreLogic property data, for example, where we have the sales records of the houses, as well as the characteristics of the houses, and linked that at an individual level to mothers' addresses in the Vital Statistics data. One example of one of the newer data sets we used is this connected device and vehicle data. So this is, again, cell phone-based mobility information, as well as if vehicles have connected information, to look at now measuring volume and measuring congestion. And so this is just an example for Portland, where we can look at hour-by-hour traffic fluctuations at a road segment level. And so this data is really, really, really expensive. And there's no way we would have been able to do it for Texas, except that the Texas Transportation Institute already had this project where they classified the most congested roadways across Texas from 2014 onwards. And so for every road segment in Texas, we can look at volume, but we can also look at speed and how that speed changes hourly. So we can start classifying congestion. So this is just an example of looking at Houston, where we have annual average daily traffic, but then for each road, we have the percent of greenhouse gas emissions that's specific from congestion. And this is really important because most of the studies that have looked at traffic-related air pollution and adverse birth outcomes, or any health outcome, rely on land use regression models or proximity. And that only tends to include road proximity and maybe a road classification for volume. So is that road a highway? Is it an arterial? Very little land use regression models actually even put in volume, right? The volume of vehicles on a road, because it's so hard to get and standardize over different areas. No study has tried to look at congestion because we just had no way of measuring that over large time periods. And so what we find is that congestion is actually a really important unmeasured component of traffic-related air pollution. So we see this very consistent association between total delay, which is a measure of congestion, and term birth weight. And this is after controlling for background traffic volume, background ambient air pollution. So this is NO2 from a land use regression model, ultrafine particles, and PM. We have a noise model. It's a pretty crappy noise model, but we try to include noise, green space, and neighborhood SES. So there's this pretty strong signal that congestion is important and that we're really not capturing this in our other methods. What the data integration allowed us to do is really do a lot of sensitivity analyses. And I'll just highlight a couple of these. One is trying to look at mothers who didn't move during pregnancy. And because we linked sales data for every household, we could look at mothers who lived in a home that wasn't sold during the 9-month pregnancy period. And so we made the assumption that if it was sold, then that would be a mother moving into that household. This has always been sort of a big uncertainty with exposure misclassification and residential selection, because that we only have address at time of birth. And so we were able to try to explore that, and we didn't really see any changes. The one thing that we saw that really modified this association is if mothers lived in a multifamily or apartment. And so if they lived in a single family home, we saw similar results overall. But this is something that we need to explore further. So is this actually modifying air pollution exposures? So apartments are tighter, they have internal HVAC, or is this representing some type of confounding through socioeconomic status and who tends to live in apartments versus single family homes? And this came from linking that core logic data for all the properties in Texas to the vital statistics information. So the last part that I want to talk about is just better geospatial data and models allow us to do different types of studies and leverage different types of study designs to potentially break or reduce this unmeasured confounding from socioeconomic status and structural factors, as well as personal behaviors. And that's the second part of what we're trying to do with this HEI study, where we've classified high congestion areas, and then we've created an infrastructure database that contains around 1,500 large highway infrastructure projects, the type of projects, where they were implemented, when they were implemented, and when they were completed. And so we're using that in a difference in differences approach to say, okay, did those projects, for example, adding a lane, adding an HOV lane, moving to electronic tolling, did those reduce congestion? And so that's using the connected vehicle data to look at changes in volume and congestion pre-post projects, but then also available air pollution monitoring data. So just, do we have existing EPA monitoring sites that have measured air pollution before and after? And then linking those to mothers who live near these projects before and after to see if they've had an impact on reducing adverse birth outcomes. And so we've created all this data, we put it together, and we're starting these analyses now. These will hopefully be done next spring when this HEI grant is completed. Another example, this is again used in this HEI grant, is using wind as an instrument variable. And so what we've done here is we basically direct matched mothers who live predominantly upwind to predominantly downwind mothers from the same road segment. And so if you're thinking about residential selection, people are aware of where a road is, and if you are able to, you would likely not choose to live next to a major road. Most people do not choose a home based on upwind, downwind, predominant wind directions. And so this is where we can try to use this as a variable that's unrelated to socioeconomic status. So when we implemented this, this was all births from 2007 to 2016. We saw some really, really interesting results. And so this is looking at our highest match quality. So this is direct matching on a road segment. We see a 16-gram decrease in term birth weight. And 16 grams is just the component that's due to the wind direction. So this is actually a fairly big association. If you think of this as in addition just to the general exposure from these roadways. We also put a lot of effort into creating shielding variables. So is there trees or buildings between where a mother lives and the nearest major road? And we see those really didn't make an influence at all in our models, which was interesting. So this is very promising, I think, in terms of a variable where we can, especially for traffic air pollution, when we're really concerned about this confounding factor, we can start to use wind to get around this issue. Okay, so in conclusions,
I think Robbie has a question, and I also have a question.
Okay,
if you don't mind.
I'm done. So
cool. Let me let you
so,
do your conclusion, and then we'll ask our questions.
For sure. So I think this is the conclusions from all the stuff I presented. I think the Google location history has a lot of opportunity, new data and models, provide new ways to measure exposures. And once we start transitioning from residential to personal exposure, we need to be really careful with these trade-offs between measurement error, bias, and confounding. And that's something I didn't really truly appreciate until I started working with this Google timeline data with the long-term time activity patterns. And then, of course, what this big data really allows in these new models is different types of study designs. And so, yes, we have this big data, but how do we use it in a better way if we want to look at causal associations? And so, as I mentioned before, this is really a large team effort. Mary Willis, who is a postdoc and who's now starting at BU in the fall, amazing researcher, did a lot of work with the HEI grant. And Andrew Larkin, he's really the data scientist behind a lot of these sort of big data approaches and novel exposure assessments in terms of how do you actually implement this in practice. And so he did a lot of that work. So with that, I can hand it over for questions. I think I finished on time.
That's great. Robbie, do you want to go first? I'll go after you.
I don't see hands or anything, so just feel free to jump in.
Yeah, Robbie will go.
Thank you very much, Joan. Thank you, Perry. That was fantastic. I thought, yeah, it was really just cool. So a lot of that is just like very.
I love
I don't know.
the presentation because it like
yeah.
you see it come together. I'm like, oh, it actually does come together somehow.
Yeah, it's hard for me to think of a better adjective than just like really cool, but like obviously very informative for environmental health. So it's really, really awesome. So I just had a particular question about your experience with PSPNet and Google Images, because I'm sort of at the beginning of a journey of trying to do something relevant to tropical cyclones and disasters. And could you please share some experience about how straightforward that was, whether it was very expensive to do an exhaustive analysis of, say, because I don't know whether it's possible to do it by a city or by a state or by the entire country, the US. Just curious if there are any resources and if you could share your experience. Thanks.
Yeah, this was a long journey, and we actually have an R01 with Peter James and the Nurses Health Study where we're doing basically what I presented, but for the whole US to link up to the Nurses Health Study. And Peter spent a lot of time working with like Google's image providers to try to get access to all that data. And so we actually have now like 500 million images for the US that we're trying to run this on. And so the one thing with Google Images is that you can't like share the information. And so they've been pretty lenient with researchers in terms of researchers using their information to link up to health studies. We still don't know if we can share that information because ideally we were thinking, well, this could be a resource for everybody in the US to potentially have. We don't know if that's going to be feasible or not just because of the terms of service. But downloading like Google Street View images and applying PSPNet is pretty straightforward now. And so we could share those scripts with you and you could probably get that up and running pretty quick.
Thanks a lot. I'm attending I'm excited about your workshop, so I'll probably follow up either by email or then. Thank you.
I think those are on our GitHub repository too. I can just send you there.
That's awesome. Thank you.
Thanks, Perry. Super interesting. I had a more specific question about the very last analysis with wind that you were presenting. And I was wondering, you showed the adjusted models. I was wondering if the unadjusted models look the same, because I think in a lot of our work, we're concerned, at least I'm often concerned about unmeasured confounding by SES.
Yep.
And this strategy seems like it may be very helpful in that regard. If I'm living across the street from you, we probably have very similar characteristics or more so. So anyway, I was curious if the wind alone before, because I saw you adjusted for multiple SES measures, whether it got you most of the way there, and if this is something we could think about.
That is an awesome question from someone who really knows these type of analyses. And because that was actually the first question I had for Andy, and the unadjusted models are larger. So we are still seeing some type of differences between matching. And right now we're trying to explore like, how is that happening? And we think it's these like regional patterns in wind that also correspond to where different populations live, right? So in like northeastern Houston, we see a predominant wind direction. And so you have more people living downwind of roads in that area, and they're different. And so that's something we're trying to figure out of like, if we restrict to certain cities or census tracts, can we get rid of that? But there is still that attenuation in adjusted models. So it's not a pure instrument at this point.
Okay, cool.
Yeah, yeah, good, very good question.
I want to point to a question in the chat. Any opinion on apps like NatureQuant? And there is a link.
Yeah, I know NatureQuant. I think they're doing some interesting stuff, and they're trying to integrate as many variables as possible. They actually don't use any Street View information because of the Google Terms of Service, right? So they're a company that's selling a product, so they can't use that information. So they're basically pulling in like NDVI, parks, that type of thing to create a metric for nature presence and quality in an area. But yeah, I've talked and met with them, and they're doing some interesting things. I'm not sure they're because how they actually come up with some of their metrics, it's like a machine learning model that tries to classify, like, because they have a whole bunch of different data linked together. They have an amazing data set, and they use these machine learning methods to try to come up with these different indexes. And so it's pretty black boxy, but they're really focused on like the consumer, right? And so like a walk score, but a nature score. And so we were thinking about using it in some health research, but it's hard to know exactly what goes into their index and what might be driving it. So we ended up not doing it.
I just want to add one quick thing to that. There are questions. Peter James, who Perry mentioned too, I think is working with that data. And the correlation with the NDVI metric is extremely high, which you might guess given the input data. So
yep.
Yeah. So the importance of considering these other factors Perry is looking at might be more valuable.
Yeah, because originally they actually reached out to me, and we had a meeting and to see how they were integrating Street View level stuff. And it ended up they weren't, just because of the terms of service that's in Google.
Adina, do you want to ask your question?
Yes, thank you so much for your presentation. I was wondering especially urban areas, if there's still a use for NDVI in quantifying green space, or if PSPNet and kind of perceptions exposure measures are preferable. Is there some information that NDVI or satellite imagery tells that the other measures do not?
For sure, yeah. I mean, it was surprising. NDVI was still the most strongly associated with all of our outcomes. I still think a lot of that is confounding, but there is something about NDVI, and NDVI captures like neighborhood sort of ambient background green space. So it is a very good measure of that. What I think Street View measures capture is like visible exposure. And so what you actually see and how you interact with green space in an urban area. And so what we're trying to do now is say, well, how do we combine all of these things? So can we create an index, or can we create some type of combined measure that would say like NDVI in your neighborhood, modified by the quality and presence of green space on the street to look at? Because I do think it's all of those.
There's another raised hand, Tom Matt.
Yeah, hi, sorry, my bandwidth isn't great, so I'm gonna leave my camera off. Thanks very much, really interesting talk, Perry. Two quick questions. One is whether the modification by apartment building versus single family home, whether you consider that might have something to do with like vertical stratification of exposure to tailpipe emissions. Mm. The other thing I'm wondering about was another externality of traffic, and whether you've investigated getting aggregated, de-identified Google data on things like vehicle speeds near, pedestrian heavy areas, or double parking in bike lanes and things like that. I mean, Google and other map providers are pretty good at helping drivers avoid speed cameras now. So they also know when people, where and when people are speeding. And obviously they wouldn't want to reveal that about individuals, but the aggregated data, I think, could be helpful in understanding safety risk, which is one of the things that, limits people's ability to be physically active in their neighborhood.
Yeah, the first question about like apartments, I think is a really good one. And that's one thing that we need to really explore further in terms of like how consistent is that modification for different areas of Texas and different types of buildings. So we have not dug into that, but we know that apartment buildings and like if you live higher and the type of HVAC can really modify sort of ambient exposures indoors. And so I think we need to look at that further versus the sort of confounding by SES component. And with the second part of that question, the connected vehicle and device data that we used is basically like Google data is part of that. So cell phone providers, again, anonymously provide this information to companies to aggregate. And so we can look at hourly changes in speed and volume and to try to start getting at like pedestrian safety and biking. We have a proposal in Oregon, actually. The Department of Transportation was interested in creating a connected vehicle ecosystem. So basically, how do you create a database that takes this information from vehicles in real time and uses it for the things that you were talking about? And so there with connected vehicles, you can actually see like where vehicles are like locking up their brakes at intersections. And so trying to classify dangerous intersections and do something about it before there's a fatality there, for example. So that data is just starting to become available, but I think in the upcoming years, a lot of states are going to be moving to a by mile road usage charge rather than a gas tax, just because of the transition to electric vehicles. So this data is going to become much more available. And I was put on this grant with engineers to say like, okay, what do we do? Like, how can we use this data for environmental and health applications? Because right now it's really in the sort of like engineering phase of how do we develop these systems.
Great, thanks.
And we're exactly at 1, so unless there are any very burning questions.
And feel free to follow up with an email if there's any other questions, for sure.
Thank you everyone for joining.
Thanks everyone.
So much.
Thank you.